How do doctors differentiate arthritis types 4 joint pain? Imagine waking up with stiff, swollen joints and wondering what's causing it. Not all joint pain is the same, and understanding the differences helps doctors find the right diagnosis. When someone reports joint pain, doctors start by asking detailed questions. They want to know where the pain is, how long it has lasted, and if it gets better or worse at certain times of day. They also inquire about other symptoms like stiffness, swelling, or difficulty moving the joint. Family history can give clues, especially if relatives have arthritis or autoimmune diseases. Past illnesses, injuries, or infections are important because some types of arthritis are triggered by specific events or conditions. Next, the doctor performs a physical exam. They look for signs like swelling, redness, warmth, or tenderness in the joints. They check how well the joint moves and compare it to other joints. The pattern of joint involvement is very telling. If only one joint is affected, it might be gout or trauma. If a few joints are involved, it could be psoriatic arthritis or reactive arthritis. When many joints are affected on both sides of the body, rheumatoid arthritis might be the cause. For example, osteoarthritis often affects weight-bearing joints like the knees and hips, especially in older adults. Rheumatoid arthritis usually involves smaller joints like the fingers and wrists on both sides. A key step is distinguishing between inflammatory and non-inflammatory arthritis. Inflammatory types, like rheumatoid arthritis, cause prolonged morning stiffness lasting more than an hour, along with swelling, redness, and pain even when resting. Non-inflammatory arthritis, such as osteoarthritis, tends to worsen with activity and improve with rest, with less swelling or redness. Blood tests for markers like C-reactive protein and erythrocyte sedimentation rate help confirm if inflammation is present. Blood tests can also detect signs of infection or autoimmune activity. For example, high uric acid levels might point to gout, but the definitive test is finding urate crystals in joint fluid. Tests for rheumatoid factor or anticyclic citrullinated peptide antibodies are used when rheumatoid arthritis is suspected. Sometimes, doctors draw joint fluid with a needle to analyze it. This can reveal infection, crystals, or other abnormalities. Imaging studies are also important. X-rays can show bone changes, cartilage loss, or bone spurs typical of osteoarthritis. Magnetic resonance imaging and ultrasound provide detailed images of soft tissues like cartilage, tendons, and ligaments. They can also detect inflammation or excess fluid inside the joint. These tools are especially helpful when the diagnosis isn't clear or to monitor how the disease is progressing. Certain types of arthritis have unique features. Gout often starts suddenly in one joint, most commonly the big toe, and is confirmed by finding urate crystals in joint fluid. Psoriatic arthritis may be linked to skin psoriasis and can affect both large and small joints. Juvenile idiopathic arthritis is diagnosed in children with persistent joint swelling after ruling out other causes. This step-by-step process helps doctors accurately identify the specific type of arthritis causing joint pain. Knowing the exact condition allows for targeted treatment, which can prevent joint damage and improve quality of life. Patients should share detailed descriptions of their symptoms and medical history to help guide the diagnosis. In the end, doctors use symptoms, physical exams, lab tests, and imaging to differentiate arthritis types and plan the best approach for each patient.